This episode of Let's Get Comfy was brought to you by Evolutionary Healthcare. Caring is what we do.
Welcome back to another episode of Let's Get Comfy Podcast. I'm your host, Norman Harris, the CEO of Comfort Measures Consulting. So glad for you to tune in and join us here live in Orlando, Florida, at the Florida Healthcare 2025 Conference. Special shout out to our sponsor, Evolutionary Healthcare. And once again, yet again, I have a long-term fan. Ever since last year when I first started the podcast, he's been supporting consistently. And I really appreciate him for joining us today on the show. Matthew Smith with Gentell, the leader in this industry, in this sector. And I always let our guests introduce themselves. So, Matt, you'll tell the audience who you are, man.
Sure. Mm-hmm. So my name is Matt Smith, and I'm a regional manager with Gentell, and we are the leading wound care company in the United States and globally.
Globally?
Yeah, globally. We're taking over the space of wound care. I personally manage a team of clinicians throughout the East Coast of Florida, and we serve nursing homes. We go in and we provide not only supplies, but the education piece at the bedside, and follow through that way. So,
yes, sir. Big responsibility and role you have there, Matt, man. Yep. And I can just tell your personality. I can just tell you, man, you're a wonderful leader.
Thank you.
And probably a good person to work for and with and partner with as well. So tell the audience here today about Gentell. Who do you serve?
Sure.
I know you say you're one of the leaders, but it's for those people, the community members that don't know.
Sure.
Explain it to them. Yes, sir.
So Gentell is very unique in terms of we manufacture and distribute our own complete line of advanced and traditional wound care supplies. Mm-hmm. In addition to that, we have many other programs outside of what a traditional wound care supply company would provide. Yes. We're taking over the wound care space because our executive leadership team, they're not stopping. They are constantly bringing on new companies and having new acquisitions, new product lines, and so really we're just becoming more of a one-stop shop, which is really turning us to be like the leader in the wound care space in general.
Yes, sir.
So, yep.
Any what would you say you guys most in-demand product is or most popular?
I would say because of the population that we serve, which is long-term care, I would say our most effective product would be anything collagen, because if you're familiar,
yes,
that population, they don't produce collagen like they once did. So it really is really wonderful for wounds that are stalled or stuck or not healing, and they have never had collagen either tried on their wounds or what have you. That would be, I say, a go-to for sure.
Right.
Yeah.
So let's talk skilled nursing facility or just post-acute space in general.
Sure. Yep.
And with Gentell, I ask you this question: improving outcomes for seniors is always a focus, right?
Absolutely.
So tell me about if you could share a story of a great impact that you all have just taken over with a new account that you may have acquired. Just tell me about how you guys help them transition and improve their healing for the wounds.
Sure. So a lot of times companies alike will go into a nursing home and they'll work with the wound provider and the wound nurse. Mm-hmm. And what I will tell you is most recently we had started a new account up in the Daytona area where they use another company formerly. We walked in and we didn't just work with the wound provider and the wound nurse. We worked with the entire team, all shifts. And that's really what makes the impact and drives those outcomes, because it's important that all the staff are hearing the same message. So we work with all the floor nurses, all your CNAs, everybody in a facility is responsible for wound care in some fashion. Mm-hmm. So that really is one of our biggest key differentiators, that we take everybody under our wing to make sure that we're all doing and walking the walk the same way. So
yes, sir.
Yep.
And the impact for your role, and I'm pretty sure this contributed to a lot of your success, is that you're a nurse as well.
Yep.
Right.
Absolutely.
So if you could just tell, because I know you transitioned to a different role with Gentell, maybe not so more hands-on,
sure,
but in a direct care line.
Yep.
But what was your biggest professional career pivot, I should say, in your career?
I would say leaving bedside and going into a leadership role.
Yeah, I feel
I wanted something more challenging, and I'm not saying bedside is not challenging by any means.
Right.
It's a different type of challenge. Uh-huh. I wanted to make a bigger impact, and me leading a team and seeing their success drives me, and then doing it on a larger scale, larger territory, if you will. Formerly, before Gentell, I worked for another company, and I was traveling all across the United States to various facilities and making an impact on that way. So I always want more of a challenge, always.
Right. Yes, sir. Now, if you can sort of let the audience know today, how's your clinical background impact, your work with Gentell now?
I would say the same thing. I worked wound care when I was a floor nurse, but it was very minimal. I wasn't the dedicated wound care nurse. I left the nursing home space and I went into a leadership role up in New York where I taught CNAs.
Oh,
And
okay.
and it was really there that I realized that I could really set the bar higher than what you see sometimes. So that led me into Gentel because I've always been passionate about outcomes in general. Wound care is like an art, you know. It's not a one size fits all, and so I like that part of it. But yeah, I'm very I have to be passionate. If I'm
Yes,
doing
sir.
it, I have to be passionate,
Mhm.
and that's what I am.
Just you evolving as well too,
Yep.
man. So just to hear that journey and see that journey for other long-term care professionals or
Sure.
nurses out there, they see that there's other options, right, in healthcare. Because of course, healthcare has so many different paths,
Sure.
that you can navigate down. But
Yep.
to see that you was able to reach, upper management level, corporate level, is another option as well. So it's
Sure.
very inspiring
Thank you. I
as well.
appreciate
So
that.
innovation, Gentell is, like you said, a world leader
Yes.
in its own space. Any upcoming releases or project that you can disclose here? Right, give us exclusive here on the podcast.
Sure, sure. So I mean, it's that could be a half an hour by itself,
Got it.
truthfully.
Okay.
But one thing that I'm personally most excited about is our recent acquisition of a company that's known for their honey-based wound care products, and that's called ManukaMed. They are now part of the Gentell family. They're based in New Zealand, and our president and CEO is actually in New Zealand, welcoming them to the Gentell family. So that's super exciting. In addition to that, we also have a program called Gentel Direct. And so when we work with these nursing homes, we're not only stopping there when they get discharged home, we're following them through. And so a lot of times that gets lost in the sauce, when they get discharged home, there's no follow through. So
Yes,
we're
sir.
not stopping there. We want to make sure wounds heal in all regard.
I love that.
Yep.
I love that,
Yep.
man. So, why should a skilled nurse facility, outside of being the largest, what is unique about you guys' approach when you're partnering with the skilled nurse facility, and why should they partner with you all?
Because we're not just sending you guys supplies and having you fend for yourself. I think really what really sets us apart, if I had to hone down to one thing, it would be the clinical education and the bedside coaching that we provide for all staff. We don't stop at wound care. I can't say that enough.
Yeah.
We take those CNAs under our wing, those nurses who are unsure about wound care. Wound care is a specialty.
Yes,
It
it is.
requires a unique skill set. So I think what
A
really
unique
sets us
person
apart.
too, man.
Absolutely.
Yeah.
Not everyone likes wound care.
No.
You have to be passionate about it,
Mhm.
and that's what I know we do better. We do it the best for sure.
And I share a personal story. This for you, Constance Black. Constance, when I was going through my AIT program
Yep.
at was it Heron Point Health and Rehab.
Okay.
So I rounded. I had to round and spend time with our wound nurse.
Okay.
So she made me go in there and watch, her provide treatment.
Wasn't for you, was it?
No,
I knew it.
no,
I knew it.
boy. No.
Yep.
Constance, she was laughing. She was all. We were both gowned up
Yep.
and everything.
Yep.
She was laughing. I said, "Hey, Constance, I'm gonna be out here behind the door, man."
Oh yeah.
But so it takes a special person
Sure.
to do that care and that work. But it's wonderful, man,
Sure.
and people need it. You want
Absolutely.
to answer a need in life? That's a need for sure.
Yeah,
For sure. So
I always tell people too, think of Gentell as your phone a friend. Don't just hit us up once a month for those dressings that we're billing to Medicare.
right.
Hit us up anytime and all the time when you have a
Mm.
question, when you have an educational need. We're going to be there.
What's one of the highest compliments you've received professionally?
Professionally, oof. Honestly, I think following a director of nursing up in New York when I worked for a company outside of Gentell, who everywhere she went, she brought me with her. And she wouldn't gear away. And that really is the highest compliment.
It is. It is.
Because trust is earned. It's not
Man.
assumed.
Yep.
So
I tell people to this day, one thing that I love is that when you hear from a CNAs or housekeeping staff that 5 years ago, 4 years ago, they're saying happy birthday or Merry
Absolutely.
Christmas, or just reaching out and say, hey, we have a building open over here.
Yep.
Norman, you should apply. That means that means a lot.
You made an impact.
Because you made an impact
Absolutely.
on them that way for them to even remember you. You may have
Sure.
not spoken with them in years.
I get it.
They
You
come
pick
out
right
of the
back
blue.
up where you left off.
Exactly.
I love that.
man. Yes. So we're definitely an advocacy platform as well. So our families out there today, what would you say is an underutilized resource that you can share with them?
Care plan meetings.
Care plan.
Yeah, for sure. It's the perfect place to ask questions, advocate for your loved one, and make sure everyone's on the same page.
I love that.
You know?
That was a great answer.
Yeah, I used to be part of care plan meetings
Yeah.
a lot when I was a unit manager, and it was refreshing and beautiful to see those families show up. You know, and when they didn't, it was like, you know, it'd be helpful to have them here. You know, so we can make sure everyone's hearing the same thing.
Honestly, that's what I added to Comfort Measures Consulting. We do have personal advocacy from a consultant standpoint, but also in person.
Sure.
If a family member want to take that extension with Comfort Measures Consulting, we attend care plan meeting representation. Of course, you can just get permission.
Yep.
If a POA, responsible party, gives permission, an advocate can come in and actually help with the families in that case. And that's why I added that piece, because care plan meetings are so important.
They're so important.
It's so important. And some family members aren't familiar with the jargon. They don't know the inner workings of a skilled nursing facility.
Correct.
So having an advocacy organization like myself, that's why I thought that was the area of need.
Absolutely.
Yes, sir.
Absolutely.
Appreciate that,
piece
man.
those things together.
All right, man. So we're wrapping up the show here.
Awesome.
And I have a question for you, man. You told me you like this question. So if wound care had a superhero, what would their name be? And would they wear a cape or a compression socks? Which one? Yeah.
Okay. First of all, their name would be granulation tissue. Granulation tissue. And the reason why is because there's so many providers and nurses who work in the wound care space who can't determine a partial thickness wound to a full thickness wound. And so that's kind of what we do, right? We're educating all the time. And so compression socks all day long. I'm on wound rounds often, and sometimes they last far longer than I would appreciate. So compression socks for everyone.
Yes, compression socks for everyone.
Absolutely.
Man, so, for Gentell, if you could share your website, social media platforms where people can find you on.
Sure. So we're on LinkedIn, Facebook, Instagram. A simple Google search is going to show you everywhere we are. We're constantly updating our socials to make sure everyone's well aware of what we're doing or what we have up our sleeve. So give us a follow, reach out anytime. I'm very active on LinkedIn as well. So you can reach out to me directly and we'll get you connected.
Well, Matt, man, I'm very grateful for you to join the platform. Gentell, you're doing an amazing job. I love the advancements. I love everyone that I've encountered, from Bryn. Matt, wonderful personalities, easy to get along with, very down-to-earth individuals. Want to meet your need. They're very welcoming, very approachable. So doing a wonderful job building the culture, for one, selecting the right people to be a part of the team.
Thank you.
And I just love the growth, man.
Awesome.
And you guys are a powerhouse for a reason.
Thank you.
Thank you. Man. So
we're not done yet.
Not done yet. Y'all way out in New Zealand.
That's right. Absolutely.
Man. So
shout out to David.
Yes, sir. Thank you for joining us here. Be sure to subscribe on YouTube, Comfort Measures Media. We have a lot of things coming up. Right. Visit our website, comfortmeasuresconsulting.com. We do have a podcast platform, but that's not all we do, right? We offer personal care advocacy. We also do business development services for independently, privately owned healthcare organizations, right? So please reach out to us. We're here to support you and for your business growth. Thank you.
Awesome. Thank you.
Yes, sir.
Appreciate it.
This episode of Let's Get Comfy was brought to you by Evolutionary Healthcare. Caring is what we do.